My dear student, I am welcoming you all to my channel. So today I am going to discuss with you about antidotes. So what do you understand that antidote? Antidote which will act against poison, or simply we may say if poison is defined as any substance that when introduced into or absorbed by the body causes illness and death. So an antidote is an agent which counteract as a poison. So this is a proper definition about antidote. Antidote is nothing but which counteract as a poison. That means if anyone introduced into or absorbed by the body causes illness and death, or any person can intentionally or unintentionally ingested by poison, so there is a causes to illness or death. So that time we are going to treat a person giving with antidote. Here the antidote is an agent which counteract as a poison. So this is the proper definition for antidote. So antidote is nothing but an antidote is an agent which counteract as a poison. Next, removal of poison from the body can be done by gastric lavage, emesis, induction and hemodialysis. So after the person intentionally or unintentionally ingested poison, so the person cause illness or sometimes may leads to death. So in order to prevent illness or the cause of death, so we are going to treat them immediately by removing the poison from their body can be done by gastric lavage or emesis induction and hemodialysis. Then next, antidotes can be classified into three categories depending upon their mechanism of action. So what are the three mechanisms? Depends upon their mechanism of action. They are classified into three categories. What are they? Physiological antidote, mechanical antidote and chemical antidote. This we'll see one by one after that discussing about saline future. Next, physiological antidote act by producing the effect opposite to that of poison. For example, here there are the two main mechanism of actions depends upon the category, like physiological, mechanical and chemical. Here the physiological antidote, example for physiological, what is the main pharmaceutical inorganic substance here used means sodium nitrite, Na, not sodium nitrate, Na. NO2 is a sodium nitrite which acts by converting hemoglobin into methemoglobin in order to bind cyanide. That means, for example, sodium nitrite which act by converting hemoglobin into methemoglobin. For example, the person ingested poison intentionally or unintentionally, so we are going to treat them with the help of antidote. Here there are the three mechanism. What are they mean? Physiological and mechanical and chemical antidote. But here physiological antidote, what is the pharmaceutical inorganic agent to be used mean sodium nitrate. After injecting sodium nitrate or after giving sodium nitrate to the poisonous case, so how it act on our body, by it will convert the hemoglobin that we know already blood contain hemoglobin, that hemoglobin converting into methemoglobin in order to bind cyanide. So this is the especially this sodium nitrate to be used for the treatment of cyanide poisoning. Cyanide poisoning means For example, the person who is working in the atmosphere like a chemical or lab, or intentionally they took cyanide, so or unintentionally also, or forcibly they ingested with the cyanide. So in that case we are going to treat them, especially for cyanide poisoning. What is the pharmaceutical inorganic substance to be used to mean sodium nitrate, like NaNO2. Here that hemoglobin converting into methemoglobin, thereby it will excreted through the kidney. So this is known as that means why it is termed as physiological antidote, means that physiologically it changes the nature of our body, like hemoglobin converting into methemoglobin, so that it is very easy to bind with that cyanide poisoning. Here the cyanide to be present in our stomach, so it methemoglobin bind with the cyanide poisoning, so automatically it will excreted through the kidney, so that the person can could be uh, released from the excessive poison, that means cyanide poison. Next one, mechanical antidote. So mechanical antidote act by preventing the absorption of poison into the body. For example, activated charcoal here plays a major role to absorb. Activated charcoal, the nature of the charcoal is nothing but it absorb the material. Like if a person ingested by the poison, so that if we are treating them, or treating with the activated charcoal, that the poison can be absorbed by the charcoal. This is comes under the mechanical antidote. Next one, chemical antidote act by changing the chemical nature of the poison. For example, here sodium thiosulfate, which changes toxic. This is also for a cyanide case. In case of like actually that how do you treat the cyanide poisoning, means in that time we have to describe lot about like sodium nitrate to be used as a physiological mechanism, and by sodium thiocyanate overall it changes the by chemical nature, that is chemical antidote mechanism under sodium Na2S2O3, which changes toxic cyanide to non-toxic thiocyanate. That means if the person ingested by cyanide poisoning, that is known as toxic cyanide, after giving them to the with sodium thiocyanate, here the sodium thiocyanate immediately, which will bind with the toxic cyanide, it will convert the changes of their chemical nature by converting into toxic cyanide to toxic thiocyanate. So in the treatment of lead poisoning, for example, the person ingested, or the person intentionally or unintentionally ingested by the lead, so it is the main used for the treatment of lead poisoning. And sodium calcium editate and dimercaprol are commonly used. So what are all the three pharmaceutical inorganic substance for lead poisoning means? So examples are Na2S2O3, it's nothing but sodium thiosulfate and sodium calcium editate and dimercaprol. And for cyanide poisoning you may say that sodium nitrate. So remember that cyanide poisoning means you should write about full detail about how to prepare sodium nitrate, and what is the mechanism of actions which involve like a physiological antidote, like sodium nitrate used for cyanide poisoning. And for mechanical antidote comes under like what is the ingredient, inorganic substance means activated charcoal. And for lead poisoning there are three pharmaceutical inorganic substance like sodium calcium editate and dimercaprol. And sodium thiosulfate is the example for lead poisoning. Then next, cyanide poisoning occurs by number of ways such as inhalation. That means I told you that intentionally there is a chances, two chances are there, by intentionally or by unintentionally. Unintentionally how it occurs means, for example, number of ways such as inhalation or ingestion of soluble cyanide salts or cyanide releasing substance such as seeds of peach, apricot or bitter almonds or cyanamide and cyanogen chloride. So these are like you in case you know seeds of peach and apricot and bitter almonds also having cyanide. So we unintentionally, if we swallow the seeds of peach or apricot, or even in the peel of almond also has the cyanide, and cyanamide and cyanogen chloride. So these are the number of ways, unintentionally or by intentionally inhalation or ingestion of soluble cyanide salts. Next, the cyanide poisoning has a characteristic odor of bitter almond. Next, sodium nitrite and sodium thiosulfate is used to counteract the sodium, and here the sodium thiosulfate plays a two role for the treatment of lead poisoning as well as cyanide poisoning. Then sodium nitrite oxidizes ferrous ion, that means hemoglobin, to the ferric form. I already discussed with that first one, physiological changes. That means how it is changing hemoglobin to methemoglobin. Usually we have in that hemoglobin contains ferrous form. So that ferrous form converting into ferric form, that is nothing but ferric form of methemoglobin. That means hemoglobin into ferrous form of hemoglobin to ferric form of the methemoglobin, which then combine with the cyanide to give cyanomethemoglobin, then methemoglobin, which is excreted in urine. So this is the proper mechanism of action of how physiological antidote occurs, like for example sodium nitrate. So you should write about these three lines in deep manner, so that you will gain the marks from the exam also. So what is the main physiological mechanism of main physiological antidote? Like ferrous ion of hemoglobin, ferrous means Fe2 plus hemoglobin converting into Fe3 plus of hemoglobin, then it will combine with, that means first converting ferrous to ferric form of hemoglobin to methemoglobin, then this methemoglobin combined with the cyanide, that means the person digested with the cyanide poisoning. So if we are giving to them, then first the hemoglobin converting into methemoglobin, then which combine with the cyanide to give cyanomethemoglobin, and then this methemoglobin which is excreted in urine. Then, and one more thing, that cyanide poisoning kit is what is nothing but, it is available in the market, like cyanide poisoning kit is nothing but it contains three major inorganic substance like amyl nitrate and sodium nitrite and sodium thiosulfate. Next, so these are the saline features we'll discussed about antidote. Then what is mean by antidote? Antidote is nothing but the proper definition, you may say that an agent which counteract as a poison. Okay. Next we'll see introduction. Overall, the poison may be defined as any substance that when introduced into or absorbed by organism causes illness or death. That is nothing but poison. So Poisoning occurs in many ways. Again we are going to discuss about by accidentally or by use of recreational substance. That means recreational substance is nothing but like such as cannabis or opiates. The person adequate with that cannabis or opiates, or next by intentional behavior, voluntarily forcing them to ingest the poisonous comes under intentional behavior. Then by accidentally means the person, those who are all working in that chemical lab, or there is the chances, much more chances to occur accidentally. And also by occupational exposure. This is also the same reason occupations. So person working in that chemical laboratory, that is that accidentally, and occupational which will comes under the same situation, so as to counteract the effect of poison. So here antidotes are used. So in order to prevent them from illness and also from death, so immediately we are going to treat them with the antidote. Here the antidote plays a major role. Okay, next that we'll see about definition of antidote. Antidote is an agent with specific action against the activity or effect of a poison, or we may say simply action against the activity or effect of poison, or simply we may say which counteract as a poison, whether accidentally or intentional, or the poisonous requires only sympathomimetic and supportive therapy. That is sympathomimetic or supportive therapy, I already told you, by inhalation, gastric lavage, like there are the removal of poison. I told you that is removal of poison from the body is first priority in case of poisoning. So it can be done by either gastric lavage or emesis induction. Gastric lavage is the process of cleaning the stomach, while emesis induction can be done by the administration of substance like activated charcoal to reduce the absorption. Here what is the difference between like gastric lavage and emesis induction means, gastric lavage, so we will insert the pipe through mouth or esophagus up to which will which will go with from the stomach itself. Thereby we will suck the poisons from the stomach. That is comes under gastric lavage. And next one is emesis. Emesis induction can be done by the administration of substance like activated charcoal to reduce the absorption. Okay, next we'll see about what are the classification, the same again which we already discussed from the saline future: physiological antidote and mechanical antidote and chemical antidote. Depends upon their mechanism of action. There are physiological antidote like changing their physiological nature. Here the sodium nitrite and sodium thiosulfate comes under to treat the cyanide poisoning. And second one is mechanical antidote. They prevent the absorption of poison like in case of induction of emesis. That means to prevent the absorption of, immediately we are going to prevent the entering into the some other organ. So immediately we are going to prevent from them immediately with the help of activated charcoal. Next one, chemical antidote. That means by changing their chemical nature, like sodium thiosulfate, which changes the toxic cyanide into next to non-toxic thiocyanate. These are the mechanism of action. Next we'll see about reason of poisoning. Poisoning of the body is due to various reason. It can be due to the presence of heavy metals such as lead, arsenic, mercury and cadmium, insecticides or pesticides used in our daily life, and cyanide poisoning which occurs due to the variety of occupational sources. So we can't say that what is the main reason of poisoning and the, so might be the presence of heavy metals such as lead, arsenic, mercury or cadmium, like insecticides or pesticides used in our daily life, on the cyanide poisoning which occurs due to the variety of, and even I told you in that cyanide poisoning some of apricot seeds and bitter almonds and peach also contain, these seeds also contain cyanide poisoning. If we swallowed this poisoning also, it cause to death. So this can be treated, the person can be treated immediately with giving antidote poisoning. Now we'll see about lead poisoning. So lead poisoning has been recognized as a major public health risk. So particularly in developing countries, though various occupational and public health measures have been undertaken in order to control lead exposure. So lead is regarded as a potent occupational toxin, and its toxicological manifestation are well known. In case of severe lead poisoning, sodium calcium acetate and dimercaprol commonly used, that means it acts as a chelation therapy, as so far been used. Sodium calcium acetate leads from bone and extracellular space and then expel out from the urine. Like as well as dimercaprol is more effective than the sodium calcium acetate as chelating. It lead from the soft tissue such as brain. Nowadays the water soluble and analog of dimercaprol has been increasingly preferred. It is suitably administered by mouth and is well tolerated. For example, in case of lead poisoning, we will go with the pharmaceutical inorganic substance like dimercaprol and sodium calcium acetate to be used for it make a chelation formation, thereby it reduces the absorption of poison from the body. So the person can be cured with that in case of lead poisoning. Then it occurs by a number of ways, such as inhalation or ingestion of soluble cyanide salts, or by cyanide releasing substance like seeds of peach, apricot, cyanamide and cyanogen chloride and bitter almond. It has a characteristic odor of bitter almond. The symptoms of cyanide poisoning are, so I already told you, sir, are the main major symptoms of the person ingested with the cyanide means, first one nausea and hypotension, and that means fall of BP, and dizziness, somehow giddiness like dizziness, and drowsiness, that feeling thirsty, much more thirsty, and coma, that means unconsciousness, and convulsion, that means epileptic, and death. So these are the main symptoms the person ingested with the cyanide. So remember that these symptoms you should repeatedly remember that what are the symptoms of cyanide poisoning, like nausea, hypotension, dizziness, drowsiness, coma, convulsion and death. So now we'll see about cyanide poisoning. So cyanide poisoning takes place intentionally or accidentally to commit suicide. Two inorganic antidote. What are the two inorganic antidote? Like sodium nitrite NaNO2 and sodium thiosulfate. So these are comes under physiological antidote. Mechanism of action comes under physiological antidote. Here we'll see about the physiological, what is the mechanism of action. First, the hemoglobin, that means ferrous form of hemoglobin converting into ferric form of methemoglobin. So after the conversion, that means physiologically the conversion of hemoglobin to methemoglobin, that means Fe2 plus, that means ferrous form, to conversion of Fe3 plus ferric form of methemoglobin. So after the, usually we will have in that blood in the form of ferrous form only. So this ferrous form of hemoglobin converting into ferric form of Fe3 plus ferric form of methemoglobin, thereby the person digested with the cyanide poisoning means. So after the conversion of ferric form of this methemoglobin bind with the cyanide poisoning, so thereby the formation of cyanomethemoglobin. So here the sodium thiosulfate here act as a, this cyanomethemoglobin, after the injected with them sodium thiosulfate or by giving them with the medicine pharmaceutical, this methemoglobin to sodium thiocyanate. First hemoglobin ferrous to ferric formation, that ferric form of this methemoglobin, that cyanide absorbed with the cyanide poisoning, thereby the formation of cyanomethemoglobin. Next, after that the person giving with that sodium thiosulfate, that immediately we are giving with them, the person ingested with the poison means cyanide poisoning means we can treat with either sodium nitrate or sodium thiosulfate. Here the sodium thiosulfate which if you are giving means, so these are the mechanism of action. After that cyanomethemoglobin converting or with the help of sodium thiosulfate, this pharmaceutical inorganic substance converting to sodium thiocyanate. So later it will excreted in urine. So these are the main mechanism of action of cyanide poisoning by physiological antidote. How physiologically changes their nature of the poison, that means ferrous form of hemoglobin to, once again I am going to tell you, ferrous form of, here what is that nature of this hemoglobin, Fe2 plus, ferrous form of hemoglobin to converting into ferric form of methemoglobin. So first physiologically here one form of changes, thereafter which will bind with the person ingested with the cyanide. So with the methemoglobin to cyanomethemoglobin. Next, this cyanomethemoglobin which will react with our pharmaceutical inorganic substance. Okay, pharmaceutical inorganic substance. What is the pharmaceutical here for the treatment of cyanide poisoning? Sodium thiosulfate. What is the formula for sodium thiosulfate? Na2S2O3. Okay. So this sodium thiosulfate bind with that in converting cyanomethemoglobin to sodium thiocyanate. So which will excreted through the urine. So the person could be treated in these cases. Okay. So next, the sodium nitrate is used for this purpose because it has very weak vasodilator action. So the among these two, like NaNO2 and Na2S2O3, so among these two inorganic pharmaceutical inorganic substance, we are giving preference to the sodium thiosulfate. Why? Because the sodium nitrate has weak vasodilator action. Okay. So next we'll see one by one. I think you may understand, all of you, my dear student, clearly you might be understood about what is the mechanism of action, physiological antidote, mechanism of action which we are giving treatment for the person digested with the cyanide poisoning. So why we are giving priority to sodium thiosulfate and not giving sodium nitrate because of this reason. So the person giving priority with the sodium thiosulfate. Okay, so now next we'll see about sodium nitrite. Okay, I think I will close with this this session. I am ending with this session. Why? Because if you are going with the continuous, so you may not able to understand very clearly. So once we'll recall those points, we'll go with the next class. Okay, thank you.